Question 1. A patient is prescribed a transdermal patch that utilizes a reservoir system. What is a critical counseling point regarding this specific type of patch? A. The patch can be cut to a smaller size for a lower dose. B. The patch must be applied to a hairy area to improve adhesion. C. Cutting the patch can cause dose dumping and potential toxicity. D. The patch should be replaced every 12 hours regardless of instructions. Answer: C. Cutting the patch can cause dose dumping and potential toxicity. This question tests knowledge of specific transdermal patch technologies, with reservoir system being the key phrase. A reservoir patch contains the drug in a liquid compartment sealed by a rate-controlling membrane, which is different from a matrix patch where the drug is embedded in the adhesive. Cutting or damaging this membrane can cause the entire drug reservoir to be released at once, a phenomenon known as dose dumping, leading to a dangerously high and rapid absorption of the medication. For example, cutting a fentanyl reservoir patch could lead to a fatal overdose. A good way to remember this is, a reservoir holds a large amount of liquid, so breaking it causes an uncontrolled flood. Question 2. Which of the following dosage forms is most suitable for a drug that undergoes significant first-pass metabolism in the liver? A. Enteric-coated tablet. B. Oral elixir. C. Sublingual tablet. D. Immediate-release capsule. Answer: C. Sublingual tablet. The concept here is avoiding first-pass metabolism, which is when the liver breaks down a large portion of a drug before it reaches systemic circulation. The keywords first-pass metabolism indicate a need for a route that bypasses the gastrointestinal tract and liver. A sublingual tablet is placed under the tongue, where it dissolves and is absorbed directly into the bloodstream through the rich network of capillaries, avoiding the digestive system and liver entirely. A classic example is a nitroglycerin sublingual tablet used for angina, which needs to work rapidly and would be ineffective if processed by the liver first. Just remember, sublingual means under the tongue, providing a direct shortcut into the blood. Question 3. What is the primary purpose of using an occlusive base, such as white petrolatum, in a topical formulation? A. To provide a cooling sensation to the skin. B. To create a protective barrier that enhances hydration and drug absorption. C. To allow the formulation to be easily washed off with water. D. To ensure the active ingredient evaporates quickly. Answer: B. To create a protective barrier that enhances hydration and drug absorption. This question assesses understanding of topical bases, focusing on the term occlusive. An occlusive agent works by forming a physical barrier on the skin's surface, preventing moisture from evaporating and thereby increasing skin hydration. This hydrating effect can also soften the outer layer of the skin, the stratum corneum, which enhances the penetration and absorption of the active drug ingredient. Ointments like Aquaphor or Vaseline are highly occlusive and are often used for very dry skin conditions or to maximize the potency of a topical steroid. Think of an occlusive base as putting a lid on the skin to lock in moisture and medicine. Question 4. A medication is formulated as an ODT. What does this acronym stand for, and what is its main feature? A. Orally dispersible tablet. It must be swallowed whole with water. B. Orally dissolving tablet. It dissolves quickly in the mouth without water. C. Ocular delivery tablet. It is placed directly on the eye. D. Over-the-counter dermal tape. It is a type of medicated patch. Answer: B. Orally dissolving tablet. It dissolves quickly in the mouth without water. This question tests the definition and function of a common dosage form, identified by the acronym ODT. ODT stands for orally dissolving or orally disintegrating tablet, designed to dissolve rapidly on the tongue within seconds, eliminating the need for water. This dosage form is particularly useful for patients who have difficulty swallowing, dysphagia, for children, or for psychiatric patients where compliance may be a concern. A common example is ondansetron ODT for nausea, which can be taken easily even when a patient feels too sick to drink water. Remember, the D in ODT can stand for dissolving or disintegrating, both of which happen right in the mouth. Question 5. Why must ophthalmic solutions be sterile? A. To prevent the drug from degrading when exposed to air. B. To ensure the solution has a neutral pH. C. To avoid introducing microorganisms and causing a serious eye infection. D. To improve the viscosity for easier administration. Answer: C. To avoid introducing microorganisms and causing a serious eye infection. This question focuses on a critical safety requirement for ophthalmic, eye-related, preparations. The keyword sterile means free from all living microorganisms. The eye is highly susceptible to infection, and its natural defense mechanisms can be easily bypassed by contaminated eye drops, potentially leading to severe infections, vision damage, or even blindness. Therefore, all products intended for ophthalmic use, including solutions, suspensions, and ointments, must be manufactured under sterile conditions. A simple way to remember this is that the eyes are a very sensitive and direct pathway into the body, so anything applied to them must be completely clean. Question 6. What is the key functional difference between a syrup and an elixir as liquid dosage forms? A. Syrups are aqueous solutions containing sugar, while elixirs are hydroalcoholic solutions. B. Elixirs are always thicker and more viscous than syrups. C. Syrups are for topical use, while elixirs are for oral use. D. Elixirs contain suspended particles, while syrups are clear solutions. Answer: A. Syrups are aqueous solutions containing sugar, while elixirs are hydroalcoholic solutions. This question requires distinguishing between two types of oral liquid preparations, syrups and elixirs. The main difference is their solvent base. Syrups are concentrated aqueous, water-based, solutions of sugar or a sugar substitute, making them sweet and viscous, which can help mask unpleasant drug tastes. Elixirs, on the other hand, are clear, sweetened hydroalcoholic, water and alcohol, solutions that are less sweet and less viscous than syrups, with the alcohol component helping to dissolve drugs that are not water-soluble. For instance, phenobarbital is often prepared as an elixir because it dissolves better in alcohol. A helpful tip is to associate elixir with older potions that often contained alcohol. Question 7. A dry powder inhaler, DPI, is prescribed for a patient with asthma. Which instruction is crucial for its correct use? A. Shake the inhaler vigorously for 30 seconds before use. B. Inhale slowly and deeply as you press the canister. C. Inhale quickly and deeply to aerosolize the powder. D. Use a spacer to ensure proper delivery to the lungs. Answer: C. Inhale quickly and deeply to aerosolize the powder. This question focuses on the administration technique specific to a dry powder inhaler, DPI, a breath-actuated device. The key is understanding how a DPI works. It contains a fine, dry powder medication that is not propelled by a chemical propellant like in a metered dose inhaler, MDI. Instead, the patient's own inspiratory effort is what pulls the powder from the device and into the lungs. Therefore, a quick, deep inhalation is required to create enough force to aerosolize the powder and deliver it effectively. An example is the advair discus, where the patient must breathe in forcefully to get the medicine. Remember this rule: for DPIs, the power comes from the patient's breath. Question 8. What is the primary advantage of a soft gelatin capsule over a hard gelatin capsule? A. They are easier for manufacturers to fill with powdered drugs. B. They can be used to deliver liquid or oil-based medications. C. they are always enteric-coated for delayed release. D. They completely mask the taste and odor of the drug. Answer: B. They can be used to deliver liquid or oil-based medications. This question tests the specific application of soft gelatin capsules, often called soft gels. The key advantage is their ability to hermetically seal a liquid, semi-solid, or oil-based drug formulation within a single-piece gelatin shell. This makes them ideal for medications that are not stable as a solid or are poorly water-soluble, as they can be dissolved in an oily base to improve bioavailability. Common examples include vitamin D or E supplements and the pain reliever ibuprofen leaky gels. A simple way to think about it is that hard capsules are for powders, while soft gels are designed to hold liquids. Question 9. Which parenteral route of administration provides the most rapid onset of action? A. Intramuscular, IM. B. Subcutaneous, SC. C. Intravenous, 4. D. Intradermal, ID. Answer: C. Intravenous, 4. This question assesses knowledge of the speed of onset for different parenteral, injectable, routes. The keyword rapid points to the route that delivers the drug to the bloodstream the fastest. The intravenous, 4, route involves injecting the medication directly into a vein, which means it immediately enters the systemic circulation and is distributed throughout the body, providing a near-instantaneous effect. Other routes like intramuscular, IM, or subcutaneous, SC, require the drug to be absorbed from the muscle or fatty tissue first, which takes more time. For instance, in an emergency like a seizure, lorazepam is used for its rapid onset. Think of 4 as a direct highway into the blood, while other routes are like side roads that take longer. Question 10. A medication is supplied as a lyophilized powder in a vial. What must be done before this medication can be administered? A. It must be reconstituted with a suitable diluent. B. It must be warmed to body temperature. C. It must be shaken vigorously to form a suspension. D. It must be filtered through a 0.22 micron filter. Answer: A. It must be reconstituted with a suitable diluent. The concept being tested is the preparation of lyophilized, or freeze-dried, medications. The keyword lyophilized powder signifies a drug that has had its water removed to improve its stability and shelf life. Before it can be injected, this powder must be returned to a liquid state through a process called reconstitution, which involves adding a specific sterile liquid, diluent, such as sterile water for injection or normal saline. Many injectable antibiotics and vaccines, like Zostavax, are supplied this way. The key takeaway is, lyophilized means freeze-dried, so you must add liquid back to it. Question 11. What is a key characteristic of a pharmaceutical suspension? A. It is a clear liquid with all drug particles completely dissolved. B. It is a two-phase system that requires shaking to redisperse solid particles. C. It is a hydroalcoholic solution that does not require shaking. D. It is a semi-solid preparation intended for external application only. Answer: B. It is a two-phase system that requires shaking to redisperse solid particles. This question asks for the defining feature of a suspension, a specific type of liquid dosage form. A suspension is a heterogeneous mixture containing solid drug particles that are suspended, but not dissolved, in a liquid vehicle. Because the particles are denser than the liquid, they will settle to the bottom over time in a process called sedimentation, creating two distinct phases. Therefore, it is essential to shake a suspension well before each use to ensure uniform redistribution of the drug and accurate dosing. Children's ibuprofen is a common suspension that must be shaken. Remember, if you can see particles or sediment, it's a suspension that needs a shake. Question 12. Enteric-coated tablets are designed to dissolve in which part of the gastrointestinal tract? A. The stomach. B. The esophagus. C. The small intestine. D. The mouth. Answer: C. The small intestine. This question tests the purpose and mechanism of enteric coatings. The term enteric refers to the intestines. Enteric-coated tablets have a special polymer barrier that is resistant to the highly acidic environment of the stomach but breaks down in the more alkaline, less acidic, environment of the small intestine. This design is used either to protect the stomach from an irritating drug, like aspirin or naproxen, or to protect a drug that would be destroyed by stomach acid, like pantoprazole. A good way to remember this is, the enteric coating acts as a key that only fits the lock of the small intestine's pH. Question 13. Which of the following dosage forms is defined as a semi-solid emulsion of oil and water, where the water content is typically higher than the oil content? A. Ointment. B. Paste. C. Cream. D. Gel. Answer: C. Cream. This question requires distinguishing between different semi-solid topical preparations based on their composition. The key descriptors are emulsion of oil and water content is typically higher. This defines a cream, which is non-greasy, absorbs well, and can be easily washed off with water, making it cosmetically elegant. In contrast, an ointment has a higher oil content, making it greasy and occlusive. For example, hydrocortisone is available as both a cream for weeping lesions and an ointment for dry, scaly skin. A simple tip is to remember that creams feel creamy and light because of their higher water content. Question 14. What is the primary purpose of a spacer device used with a metered dose inhaler, MDI? A. To increase the dose of medication delivered with each puff. B. To eliminate the need to shake the MDI before use. C. To improve coordination and increase drug delivery to the lungs. D. To allow the inhaler to be used with a dry powder. Answer: C. To improve coordination and increase drug delivery to the lungs. This question is about the function of an accessory device for inhalers, the spacer. A spacer is a holding chamber that attaches to a metered dose inhaler, MDI, to overcome the difficulty of coordinating actuation, pressing the canister, and inhalation. It slows down the aerosol cloud and holds it briefly, allowing the patient to breathe in the medication more slowly and completely, which reduces drug deposition in the mouth and throat and increases the amount that reaches the lungs. This is especially helpful for children and the elderly who may struggle with the press and breathe technique. Think of a spacer as a helping hand that makes sure the medicine goes where it's needed. Question 15. A suppository is a solid dosage form intended for insertion into which body orifices? A. Nasal cavity or ear canal. B. Veins or arteries. C. Rectum, vagina, or urethra. D. Under the tongue or in the cheek. Answer: C. Rectum, vagina, or urethra. This question tests the definition and routes of administration for suppositories. A suppository is a solid or semi-solid dosage form that is designed to melt, soften, or dissolve at body temperature after being inserted into a body cavity. The most common routes are the rectum for systemic or local effects, e.g., glycerin for constipation, the vagina for local effects, e.g., clotrimazole for yeast infections, and less commonly, the urethra. The base of the suppository, such as cocoa butter or polyethylene glycol, is what allows it to melt and release the medication. Remember that suppositories are designed for specific body cavities and are never taken orally. Question 16. What differentiates a pharmaceutical gel from a cream or ointment? A. Gels are solid dosage forms that must be dissolved in water. B. Gels are typically clear and have a high water content, creating a cooling sensation. C. Gels are oil-based and provide a strong occlusive barrier. D. Gels contain large, gritty particles suspended in a liquid. Answer B. Gels are typically clear and have a high water content, creating a cooling sensation. This question asks for the unique characteristics of a gel compared to other topicals. A gel is a semi-solid system where a liquid phase is trapped within a three-dimensional matrix of gelling agents, making it appear solid-like but having a high liquid content. They are often clear, non-greasy, and spread easily, and the evaporation of their water or alcohol base can produce a pleasant cooling effect, which is why they are popular for products like topical analgesics, e.g., Voltaren gel, or aloe vera. Think of gels as being similar in texture to hair gel or jelly, clear, water-based, and light. Question 17. Which of the following is an example of a dosage form that provides a depot effect? A. An intravenous bolus injection. B. An immediate release oral tablet. C. An intramuscular injection of a viscous, oil-based solution. D. A sublingual spray. Answer C. An intramuscular injection of a viscous, oil-based solution. The concept tested is the depot effect, which refers to a formulation designed to release a drug slowly over a long period from the site of administration. The keyword depot implies a storage site. An intramuscular, IM, injection of a drug in a viscous oil vehicle, like Depo-Provera, medroxyprogesterone, creates a localized reservoir or depot of the drug within the muscle tissue. The drug then slowly leaches out from this depot into the bloodstream, providing a sustained therapeutic effect for weeks or months, reducing the frequency of administration. Remember, a depot is like a storage tank for the drug inside the body. Question 18. What is the primary reason that some intravenous, 4, solutions must be protected from light? A. Light can cause the solution to become too cold. B. Light can cause a chemical degradation of the active drug. C. Light can cause the 4 bag to become brittle and leak. D. Light can increase the risk of microbial contamination. Answer B. Light can cause a chemical degradation of the active drug. This question addresses a critical stability issue for certain medications, specifically photosensitivity. The key phrase "protected from light" signals that the drug is light sensitive. Exposure to certain wavelengths of light, particularly UV light, can provide the energy to trigger chemical reactions that degrade the active pharmaceutical ingredient, rendering it less effective or even converting it into toxic byproducts. Drugs like amphotericin B, nitroprusside, and some multivitamins are highly photosensitive and must be administered in opaque bags or with amber-colored tubing. To remember this, think of how sunlight can cause colors to fade on a poster. It's a similar process of chemical breakdown. Question 19. An effervescent tablet is designed to be administered in what way? A. Swallowed whole with a large glass of water. B. Dissolved in a liquid, such as water, before administration. C. Chewed thoroughly before swallowing. D. Placed under the tongue until it fully dissolves. Answer B. Dissolved in a liquid, such as water, before administration. This question tests the proper administration method for an effervescent dosage form. Effervescence is the chemical reaction that occurs when the tablet, containing an acid, like citric acid, and a base, like sodium bicarbonate, is dropped into water, producing carbon dioxide gas, fizzing. This action helps the tablet dissolve quickly and can also mask the taste of the medication. Swallowing an effervescent tablet whole is dangerous as the rapid release of gas in the stomach can cause choking or severe bloating. A well-known example is Alka-Seltzer. The key is in the fizz. Effervescent tablets are meant to be a bubbly drink, not a pill. Question 20. What is a key feature of a medication delivered via a nebulizer? A. It is a dry powder that is inhaled forcefully by the patient. B. It is a liquid medication that is converted into a fine mist for inhalation. C. It is a propellant-driven aerosol that requires coordination to use. D. It is a solid tablet that is dissolved in the machine before use. Answer: B. It is a liquid medication that is converted into a fine mist for inhalation. This question focuses on the mechanism of a nebulizer, a specific type of inhalation device. A nebulizer uses compressed air or ultrasonic waves to break up a liquid medication, often supplied in single-use vials called nebs, into a fine, breathable mist or aerosol. The patient then inhales this mist through a mouthpiece or mask over several minutes, which requires no special coordination or forceful breathing. This makes nebulizers ideal for infants, young children, or patients in severe respiratory distress who cannot effectively use an MDI or DPI, such as during an acute asthma attack. Think of a nebulizer as creating a medicated fog that is easy to breathe in. Question 21. A patient receives a prescription for a Troches. How should this dosage form be administered? A. It should be inserted rectally. B. It should be swallowed whole with water. C. It should be allowed to dissolve slowly in the mouth. D. It should be applied topically to the skin. Answer: C. It should be allowed to dissolve slowly in the mouth. This question tests the understanding of a less common dosage form, the Troches, which is also known as a lozenge or pastille. A Troches is a solid or semi-solid dosage form containing medication in a flavored, sweetened base designed to dissolve slowly in the mouth to provide a local effect in the pharynx or a systemic effect through absorption. This slow dissolution maximizes the contact time of the drug with the oral or throat tissues. A common example is a clotrimazole Troches for treating oral thrush. Remember that a Troches is like a medicated candy. You let it dissolve slowly to get the full effect. Question 22. What is the primary purpose of adding a suspending agent to a liquid formulation? A. To increase the solubility of the active drug. B. To make the final product sterile. C. To increase the viscosity and slow down the settling of solid particles. D. To add sweetness and flavor to the medication. Answer: C. To increase the viscosity and slow down the settling of solid particles. This question focuses on the role of an excipient, or inactive ingredient, called a suspending agent. In a pharmaceutical suspension, where solid particles are dispersed in a liquid, these particles tend to settle over time due to gravity. A suspending agent, such as acacia or xanthan gum, is added to increase the viscosity, thickness, of the liquid, which physically slows down the rate at which the particles settle. This helps keep the drug more evenly distributed, leading to more uniform and accurate dosing, although shaking is still required. Think of a suspending agent as a thickener that makes it harder for the drug particles to sink to the bottom. Question 23. A patient is prescribed an Otic suspension. What is a critical aspect of this dosage form? A. It must be administered at a very cold temperature. B. It must be shaken well before administration and is for use in the ear only. C. It can be used interchangeably in the eyes or ears. D. It should be injected directly into the eardrum. Answer: B. It must be shaken well before administration and is for use in the ear only. This question tests the properties and use of an Otic preparation, with the term Otic being the keyword that means related to the ear. As a suspension, it contains solid particles that will settle, so it must be shaken well to ensure a uniform dose. A critical safety point is that Otic preparations are specifically formulated for the ear canal's pH and conditions and must never be used in the eye, as they are not necessarily sterile and may contain ingredients harmful to the eye. An example is Ciprodex, ciprofloxacin/dexamethasone, Otic suspension for ear infections. Remember the rule: Otic is for the ear, and Ophthalmic is for the eye, never mix them up. Question 24. A drug is formulated as a delayed-release capsule containing enteric-coated beads. What is the mechanism of this dosage form? A. The capsule dissolves immediately in the stomach, releasing the drug for rapid absorption. B. The capsule itself is enteric-coated, dissolving only in the small intestine. C. The capsule dissolves in the stomach, but the small beads inside have an enteric coating to protect them until they reach the small intestine. D. The capsule must be opened and the beads sprinkled on food before consumption. Answer: C. The capsule dissolves in the stomach, but the small beads inside have an enteric coating to protect them until they reach the small intestine. This question assesses a more complex, multi-part dosage form, a delayed-release capsule with enteric-coated beads. The keywords delayed release and enteric-coated beads point to a specific release mechanism. In this design, the outer capsule shell is meant to dissolve in the stomach, releasing its contents. However, the contents are tiny drug-containing pellets or beads, each with its own enteric coating, which prevents them from dissolving until they pass from the stomach into the more alkaline small intestine. This design, used in drugs like dexlansoprazole, Dexilant, helps protect the drug from stomach acid while allowing the beads to disperse for more consistent absorption. Think of it as a Trojan horse. The capsule opens in the stomach to release tiny, protected soldiers that continue on to their target. Question 25. Which characteristic best defines a pharmaceutical paste? A. A liquid formulation with a very low viscosity. B. A clear, transparent gel that liquefies on contact with skin. C. A very thick, stiff ointment that is highly protective and less greasy. D. An aqueous solution intended for injection. Answer: C. A very thick, stiff ointment that is highly protective and less greasy. This question tests the definition of a paste, a specific type of semisolid dosage form. A paste is similar to an ointment but contains a much higher percentage, often 20 to 50%, of solid, insoluble powder, which makes it very thick, stiff, and less greasy than a typical ointment. This high solid content makes pastes highly protective and absorbent, forming a thick barrier on the skin, which is why they are often used for conditions like diaper rash. A classic example is zinc oxide paste, which forms a dense, white, protective layer. A good way to remember this is to think of toothpaste. It's thick, holds its shape, and contains solid particles.